prior to doing this interview, I would have never thought or even called myself a woman in data science. But I think after looking at everything we've done this summer, everything I've learned and what I want to do going forward, I feel a lot more comfortable with thinking of myself as that. And I think that's where it starts for a lot of us.
My name is Melese. I went to the University of Colorado, Denver, and I graduated in the spring of 2022, and I studied biology with a minor in math.
Hi, my name is Perez, and I recently graduated from UCLA in the spring of 2022. There, I studied international development, which usually isn't the first thing you think of when you think of someone in data science. But having grown up in Compton as a low-income daughter of immigrants, a lot of my pathway has been informed by the desire to improve disparities for vulnerable populations, especially through public health.
I came here 6 years ago from Tigray in the Horn of Africa. I am a first-generation college graduate. I was always curious and very passionate about the healthcare and healthcare system. But my idea of healthcare was doctors and nurses and hospitals giving care to patients. I never thought of healthcare beyond that.
This summer, my partner, Mileati, and I had the amazing opportunity to participate in the Stanford AHEAD summer program in epidemiology and population health under Dr. Sherri, who is amazing and has honestly been one of the biggest mentors in my journey so far.
I've been involved in other summer research programs, both as a student and as a faculty mentor, and I brought those experiences to designing the AHEAD program with my colleagues. I brought my own lived experiences where I grew up in a low-income household facing food insecurity and lack of social support. The genesis of the AHEAD program came from our joint understanding about the urgent need to diversify the research workforce in quantitative population health at all levels.
Mileati and I worked on a project about algorithmic fairness in the insurance risk adjustment formula, specifically in Medicare, and how undercompensation can harm adults that are 65 and up, are minorities, or have multiple chronic diseases.
So the most surprising part was how the lack of community engagement and research can really limit your finding and also the solutions that you come up with.
We ended up finding that healthcare payment plans can appear to be further optimized and can play a role in reducing some healthcare inequalities caused by undercompensation.
So from our findings, insurers discriminate against the populations that they deem are unprofitable.
I think the most exciting part about working on a project like this is that you can really see the direct potential that it has to improve the life of people and their quality of life in terms of their health.
I knew I had a deep appreciation for biostatistics, but I didn't know how biostatistics would play a role in addressing healthcare issues. Through the research I did, I was able to practice and see the application of biostatistics in healthcare policy. That is something that influenced my decision to continue biostatistics to graduate program.
And so a lot of the times while we were working on our project and learning these brand new skills, we were very hard on ourselves, Mileati and I, in feeling like we had to know everything that was going on and be perfect. But I think if you don't feel like you're struggling, if you don't feel like you fail at least once and over again, then you're not learning. That those are just as important parts of the process. And especially when it comes to data science, there's going to be a lot of failures, a lot of troubleshooting, a lot of figuring things out. Those are things that we have to learn to welcome instead of be afraid of.
To current students, my advice is often there are more people than you know that are willing to help you succeed. So if you need help, ask. You're going to find someone to help you out.
And that's the purpose of programs like these and Women in Data Science, that you're not just watching a community happen, you're not watching data science happen, but you're part of that community. And you're not on the sidelines, but it's you who is the community. I am Perez, and I'm a data scientist.